Even though it is a progressive disease, can we prevent the disease in the earliest form?
A lot of people are coming with memory loss. They have some propensity to develop cognitive impairment, but because they were locked down, they were not able to meet their near and dear, not able to go out, they manifested. So any disease which makes you bedbound, it keeps you in a room, can hasten your memory loss. Among them, most prominent is your brain stroke and heart strokes. How to prevent? Be active. Try to be active and lead a healthy lifestyle.
I prompted another guest to unmute yourself. Kindly unmute yourself.
I am Dr. Sundar Rajan, Siddha Doctor. Even though it is a progressive disease, can we prevent the disease in the earliest form? Shall we have any natural remedies to prevent the disease in the earliest form? Natural remedies, apart from the pharmacological, modern pharmacological, can we have some any natural remedies and methodologies to prevent the disease at the earliest form? And any other diseases which are associated with the dementia to fasten the process of dementia.
Dementia can be prevented. I think dementia, if a person is the disease itself cannot be prevented, but we can scale down the disease progression. We can keep them in a very early stage, or even we may be able to keep in that stage. We may not progress to clinical stage by doing normal physical activities, simple things, going for daily physical exercises, learning new languages, music helps, social contact, going out, doing activities. Don't keep yourself idle. And here one more thing is one should always look after their general well-being, like what we say, early to bed, early to raise, keep immense healthy and wise. So you should not proper sleep, have a proper diet, add a lot of fruits and vegetables, a lot of junks in preventing dementia. The diseases which are associated with cognitive impairment or now regarding the diseases which may hamper your which can hasten cognitive impairment, cardiovascular means coronary artery disease, heart diseases, your brain strokes, patients having high cholesterol diet, hypertension, diabetes, all have contributing factor in hastening or in increasing the severity of dementia. We have to control all those things. Mechanism of action is because if you have a heart disorder, there will be so dementia. Sir asked two questions. One is how to prevent the dementia in natural way. Number two is what are the disease associated with dementia, which may hasten the disease progressions. Right. Preventive strategies. All the things which you are doing now, like having physical activity, be active, go to morning walk, evening walk, socially interact with people, eat healthy diet, add lot of fresh vegetables and fruits in your diet, control your blood pressure, control your sugar, avoid sedentary lifestyle. All this help in reducing cognitive impairment, in preventing cognitive impairment. Number two is your second, and there is no other extra medications or nothing, no natural remedies. You have to be active in your life. Simple thing. Number two is what are the diseases associated with dementia, which increases the cognitive impairment. One is your heart diseases, ischemic strokes, brain stroke, or other disorders where patient becomes sedentary, doesn't go out. A old person having knee replacement is not going out, not mixing with people, have some underlying cognitive impairment which is undiagnosed, it will increase. Latest example is your COVID lockdown. A lot of people are coming with memory loss. They have some propensity to develop cognitive impairment, but because they were locked down, they were not able to meet their near and dear, not able to go out, they manifested. So any disease which makes you bedbound, it keeps you in a room, can hasten your memory loss. Among them, most prominent is your brain stroke and heart strokes. How to prevent? Be active. Try to be active and lead a healthy lifestyle. I just want to add this too. I think I hope I cleared his doubt. Yes.
One more question. Even though the dementia is associated with the elder age groups, most of the children, not most of the children, some of the children are very poor in studies. they have some forgetfulness in the studies. Is it related with any neurological function or it is an ordinary one?
Can you rephrase the question, sir?
Sir, even though the dementia is associated with the elder age group, some of the younger peoples also are forgetful in nature. How can we differentiate that? Is it dementia or it's a normal forgetfulness condition?
So, as I mentioned like before in the slide which I kept, which I showed you in my presentation, normal forgetfulness and abnormal forgetfulness. In normal forgetfulness, people we tend to retrace it and we may able to remember it after we think about it. Now you have seen a lot of students coming with, I'm forgetting my studies, I'm not able to remember my topic, but he or she is able to do all his active other things. If you ask him which movie you have seen or who is your favorite actor, when is the next IPL match, they may able to tell. So I won't say ki like everybody may have that any cognitive impairment. Is more like an attention, is more like an interest. So I am interested in studies, I will read and I will remember. One person who is not interested in sports, he will not remember which IPL match happened and who is the winner of IPL 2026 or who is the winner of IPL 2025. So is all more on the area of interest. Now, if you feel like that memory loss is hampering his day-to-day activity, it is not normal thing. Like after eating food, he will forget whether he has ate food or not. He would be frequently skipping appointments, not all those appointments which he has been forced upon. Then we may feel okay, there may be some cognitive impairment and he should reach to the doctor. And here also there could be psychiatric or neuropsychiatric symptoms would be also playing a role, like depression. I am depressed. I'm not showing interest to learn things. I may develop forgetfulness. 60 to 70% young people who are coming to our memory clinic are usually having some personality disorder or some depressive underlying depressive disorders.
Okay, sir.
So coming to the general physician is always an important thing, or taking help, medical help is always an important thing.
Okay, sir. Thank you. Thank you.
Thank you, sir. I'd like to ask an additional question regarding to that question itself. So,
Yeah.
sir, we have noticed that, excessive usage of social media, watching reels and everything, a lot of people have a shorter attention span in today's day due to, say, reel content, 7 to 30 second, 1 minute reel content, and binge scrolling, and then excessive dependency on AI for doing work or for gathering information. So, excessive of doing these things, could they be in the future? Could it be problematic, and could it be leading to Alzheimer's and dementia in some cases?
I don't say see, I will not stamp it like doing these activities or those person who having very decreased attention span because of scrolling reels and all those things will lead to dementia, but it will definitely lead to behavioral issues like depressions, anxiety, socially. They may feel like I'm socially outcast. I have to do a lot more thing. I have to dress in that way. And it's more like a behavioral or your psychiatric illness symptoms. Now, these people will develop cognitive impairment in future, maybe, may not be, or maybe they also play a contributing factor. Okay. So here both can be true. Yes is also true, no is also true. It's a very controversial topic. Okay. But I will advise not to do those things.
Thank you so much.
Has become a part. I think we all are like, doom scrolling. But the thing is that that is not the only factor, right, of our cognition. Are we doing other things? Like a lot of us would be like into other skills. So that will help to have a better cognition. So in case like even if we are like doing a doom scrolling, but the rest of the time maybe we are doing some physical exercise or some other activity that will help to improve the cognition. Or some people are into learn different skills, learn different language. So this is like, yes, this is something new that has come, but then there are studies which are saying that it will have some sort of a cognitive impact on. But then if you think of AI, right? So AI, if you even have to ask, you are still using your cognition. Yes, the time span of your answers have become shortened because AI is answering you, but you need to know the right question. So that is the cognition you are still using. So it is a very difficult thing to say. As Dr. Sandeep also said, that it's not like a yes or no, but it is overall your cognitive well-being and a lot of other factors. So all the factors, like how healthy is your brain with respect to all the other things. How good is your food or nutrition, your sleep, your other lifestyle factors. So it all comes down to, like, it's a package, not like one thing.
Okay, so the next question is for you. In the slide of normal aging versus abnormal aging, is there a grading or are there levels to it?
No, there is no grading or levels here, sir.
Right.
There's no grading or levels, but you have to be see, so it's just like the slide is, a lot of people are coming and telling I have forgetfulness, I'm not able to remember name, I'm not able to follow the instruction. It's for that thing. There is no
Right, sir.
staging, no grading. So staging and grading are those persons who have cognitive impairment.
So out of all of the kinds of dementia-related diseases that you mentioned, which one is the commonest?
Alzheimer's is commonest, okay, but in the Indian context, I will say the mixed dementia is much common. Alzheimer's plus vascular. So in worldwide context, Alzheimer's is the most common cause of dementia. Indian context, I feel mixed dementia is very much common. Mixed means Alzheimer's with some component of vascular dementia, like both the pathologies are there. And Alzheimer's, they usually present with memory loss, like forgetting things, forgetting appointments. They don't have so much of behavioral issues. Okay, and Alzheimer's is the most misdiagnosed. A lot of dementia patients are diagnosed with Alzheimer's. They may be having some other cause of dementias, and patients with Alzheimer's are also least to come to the doctor. They have only memory loss, and people feel like, okay, I have some, he is forgetting because he's old age, and they won't be showing any behavioral issues which cause any behavioral symptoms which are distress to the caregiver, so they don't reach to the doctor. So if you ask for the hospital data, FTD is most common. In general, Alzheimer's is common.
Thank you so much, sir. So are there any devices available for assessment of cognitive functions?
Not devices as such. We have questionnaires, like where we do the assessment and we ask some questions which are particular to each domain, and we get a score, and it tells us like in which stage the patient is.
The next question is from ma'am. Is RTMS therapy a good option for dementia care?
So I will answer it. So transmagnetic stimulation therapy doesn't have proven efficacy. There are not much papers, but some few case reports. They say it works. They say it not work. But it is not a established or approved therapy for cognitive impairment.
Thank you. So could you all guide on how to set up a memory clinic?
Okay. Yeah, sure.
Equivalence.
So, yes. So what can be done is, say, memory clinic needs couple of things which are like the crucial points of it. Like there has to be a medical doctor. So it can be like a neurologist or a psychiatrist. Generally, a neurologist works best, but then it can be a combination of these two. There has to be maybe a psychologist, someone who can do like assessments, counselings. So memory clinic is basically like, a combination of people. Then we have like speech therapists, we have occupational therapists. So, but for a start, you can just have like, the medical doctor and maybe a psychologist or a counselor who can do the assessment. So here, memory clinic establishment is more like what is the role that you're looking for rather than what people you're looking for. So it's like you can have assessment, screening, assessment, diagnosis. So some memory clinics will not necessarily they will have a doctor, which means that they're not doing a diagnosis. So you have to be defined on, what you want to do. But the ideal thing is like there is a screening, there is a diagnosis. So for the sake of diagnosis, you need a doctor there. And then there are like, post the diagnosis, there is counseling and the other intervention that all happens in the memory clinic. So I think it is more to get the idea of like, how you would like to have the setup. So basic needs, I think I have mentioned it.
And the next question is from Sachi, is a counseling psychologist, neurodivergent population. I am practicing for 3 years now. During my PG program, I did my internship in geriatric department. Time and again, I get back to problems related to old age population.
Related to?
Still don't feel confident as related to old age population. still don't feel confident enough with practicing, so keep on referring clients to others. If you can guide me with any problem or books to refer to, I will be very grateful.
Well, I can look up to something and get back on this, but
Sure, you can send it to my team and we can send it to them via
yeah.
email.
When you're talking about more of a geriatric counseling, it is more of a different population that you are seeking for. So, it is the geriatric population, right? So, I can't name a book right now, but maybe I can look up to something. And yes, it is more to do with the experience also. Yeah. So, let's see if I can help you with that. Yep.
Thank you. You can send the links to us anytime and we'll share it with the person who's asked the question. Just now, how many patients are at what stage of dementia, Alzheimer's? How much percentage in stage one or stage two or so? That would have to be a very comprehensive study, whereas I don't think such a study would have been made appropriately in the country.
Yeah, maximum number of patients are still in stage one and stage two. But if you look at the hospital data, it will be more, they will be on stage two or stage three. Because people, they don't come till the patient is behaving very abnormally, or her activities are, or impairment is hampering their day-to-day activities. Small things, they don't come. It is true for all diseases. It's true for dementia. Okay. See, you won't be reaching out to a cardiologist till you have a massive heart attack, right? Some chest burn, you may feel like a small thing. I don't want to go out, right? Similarly, it is more true to the people with dementia. Like, okay, he's having some memory loss, and because of the stigma and because of those lack of awareness, most people, they don't turn down to the doctors. Hospital data, you will find maximum number of people are in stage 2, stage 3. Community data, 70 to 80% are still in stage 1, stage 2. Stage 0, I will say stage 0.5 in stage 1. But I'll just add it, like, see the number that there are more than 9 million people living with dementia. So it is not like they are per stage. Anyone who develops dementia will start like early stage and go to moderate and severe stage. We may not have that kind of studies to say what particular, but anyone who is diagnosed with dementia will eventually from an early stage to moderate stage and then severe stages. So yeah,
And that too,
that's a
with the number of people who have been also very unclear. I mean,
yeah.
because of the social stigma and everything, so many people wouldn't be going for the tests itself. So long way to go there. Ask for your contact details. We'll send in the
It's on the last.
Yes. We'll share the last slide. We'll also share the contact details with ma'am after the session. Okay. Your screen is stuck. Anyways,
Yeah.
I think we've covered all of the questions in the chat box and also the ones that were raised personally by people. With that, I'd like to now conclude the session. Thank you so much, sir, for joining us. It is a pleasure
Thank you.
having you with us. And like always, ma'am, it's always a pleasure to have you with us. Thank you for joining us again for your time and patience.
Thanks.